Hi, I'm Cindy Crosby from birthsmart.com, and I'm continuing my series, The 6 Traits of Optimal Maternity Care. Today's topic is pushing occurs in any position but flat on your back. And as we see images on television and in movies of women giving birth, almost without exception, we see these women lying on their backs when they give birth to their babies. I remember one example I saw where a woman had an extremely sudden and fast and unrealistic labor. She was in a convenience store and that baby was just coming, but she took the time to position herself and to lay down flat on her back on that disgusting floor so that she could give birth. And I just kind of shake my head at examples like that because I really believe that if women are left to their own devices, they would almost never choose that position. When you talk to pregnant women, they can pretty much all testify to the fact that lying on your back is probably the most uncomfortable position to be in. And the reason for that is just as the baby grows and gains weight and the uterus gets bigger, it is very heavy. And when we lay on our backs, it causes back pain. And there are a few major blood vessels as well that travel just behind the uterus. And actually the weight can sometimes restrict that blood flow and the oxygen supply to you and to your baby. And that's why some women get dizzy and lightheaded after lying on their back for a short period of time. Many providers encourage women to avoid sleeping on their backs in late pregnancy for these reasons. And so it's kind of ironic that many American women end up delivering their babies on their backs. About 60% of women in recent years have been giving birth in that position. In addition to the problems I've already mentioned, another challenge is that in order to navigate the shape of the pelvis, from that position, a baby will actually have to travel slightly uphill to kind of make it over the hump to get out. And I think birth is challenging enough without adding an extra level of difficulty that's unnecessary. I don't know about you, maybe I'm wrong. But another problem is that our tailbone actually is hinged, and if we're in a position where it can move freely, we can expand our pelvis just that little tiny bit and make more room for a baby that might need more room. But when we're flat on our backs, it's compressed, and so we only have the space that's available. So there are positions that are more favorable and that can take advantage of gravity to help assist us in labor. As we consider those, standing is one, squatting is another good one, kneeling, whether it's upright or kneeling hands and knees, those are all great examples. And as we look around the world and as we study historically different cultures, these are the types of physiologically normal positions that women have gravitated toward. And I think there's something to be said about becoming familiar with these options and kind of leaving it open and then following your instincts when the time of birth comes, because often what you feel is most comfortable will be the best position for you. So women who choose an epidural are a little more limited in their options, but they still have options. They might not be as inclined to stand to give birth, and squatting might be a difficult position to get into without a lot of support, but I have seen it done. One position to consider is side lying, and side lying, it's gravity neutral, so it doesn't give us that advantage of gravity, but it overcomes the other problems with the lying flat on your back position. So those are just a few ideas I wanted to share with you, and I just want to encourage you and plant that seed in your mind to want to stay off your back during labor. And I'd also encourage you not to believe everything you see in those TV births. In fact, don't believe pretty much everything you see in those TV births. Thank you so much for taking the time to join me, and I look forward to sharing more with you soon. Have a good day.